Okay, I understand that we have everything in place, and we are going to start now straight away. So thank you for your patience. Thank you very much for your time. If you have just joined the call, this show is proudly sponsored by Salad Master, your number one health and nutrition company. And remember what they say: your health is your wealth, and all the information that we are going to be gathering from this health talk today is going to help us in the prevention and also in fighting the coronavirus. And just in case you have anyone or you know of anyone who probably has been linked to the COVID-19, you can ask them to just click on the link and join so that they can better know how to protect themselves. They can be better informed, so to speak. Now, when I started, I said that, of course, a lot of people know about the global pandemics that have ravaged the world in time past. They know about the Ebola virus. They know about the avian influenza. Today, we are focusing on the number one discussion on every TV station today, the number one discussion on everybody's lips today, and that is we're discussing on the coronavirus today. And we're not just talking about the coronavirus. Dr. Dolly, our in-house salad master doctor, is going to be talking on how to, of course, prevent and, of course, how to treat the coronavirus, how to prevent and how to treat the coronavirus. And like I said, just in case you can't come on the Zoom link or people you have invited cannot connect on the Zoom link, you can, of course, go to the YouTube because we are streaming live on YouTube. And before I hand over to the studio, where I have Dr. Dolly and Ms. Tony Bello, I want to say that it's an interactive session today, so you can ask all your questions today. You can ask your questions using the Q&A button just above on the top of your screen if you're using an Android phone, or sometimes it's just beneath if you're using a computer. It's the Q&A, the question and the answer button. Just click on it and ask all your questions relating to the COVID-19. And guess what? Rest assured that we're going to take all your questions. Now I can see live pictures coming from the studio. Thank you very much indeed for joining us again, and let everyone know that this show is live. So thank you very much for coming on. I can see Mr. Tony and, of course, our in-house salad master, Dr. Dolly. Good afternoon, guys. How are we doing today? Good to see you.
Good afternoon, Marvel. Good afternoon.
Good afternoon, Marvel.
Sorry.
Thank you very much.
Sorry, we had a technical issue. Yeah,
right.
But we're here now and we're ready to go. I said, aren't we, Dr. Dolly?
Yes, we are.
Fantastic. Yeah, so just let me introduce myself. My name is Tony. I am the regional manager for the Excel Regional Salad Master, and we proudly sponsor this show by Dr. Dolly, which is the $1 billion body. And I'll just hand over to Dr. Dolly just to introduce yourself.
Okay. Hello, everyone. My name is Dr. Dolly Mukage, aka Dr. D, and I'm here today. I'm the in-house doctor for Salad Masters, and I'm proud to be associated with such a wonderful brand. So we're here today on the program, Your $1 Billion Body. And the topic of discussion today is understanding coronavirus, also known as COVID-19.
Fantastic. I hope you can all hear us outside there on YouTube and also on Zoom, and some of you might be on Facebook. You know, what we'd like you to do is put your comments in. Also, if you want to find out more about the program, more about things we do, please subscribe and like our channel on YouTube. What I would like to start off by saying is, Dr. Dolly, this coronavirus, or they say COVID-19, briefly, quickly, people get confused. Why did they change coronavirus to COVID-19 before you get started?
Wow. Coronavirus actually is a family of viruses. It's not just one virus. COVID-19 is part of the family of the coronavirus family, which is what we intend to understand fully today. So if you call coronavirus, you can be as well mentioning SARS, and MERS and all other members of the family. But COVID-19 is the specific organism that causes you to come down with the infection we call coronavirus disease.
Wow, wow.
Yes.
When they say COVID-19, do you know what the COVID, where did the 19 come from? Because I got confused. First we were talking about coronavirus,
Yes.
and then we were talking about COVID-19, and I got confused because I was like, where did the 19 come from? Because was there an 18? Was there a 17? Was
No.
there a 16?
No.
Because COVID-19 just came and just bam, COVID-19.
COVID-19, the name came from COVID is gotten from the coronavirus family, and 19 is the first incidence or the first case, confirmed case of coronavirus disease was reported in Wuhan, China in 2019. That's where the 19 came from. So it's now called COVID-19, short for coronavirus disease 2019.
Wow, I am already. I have acquired knowledge. I'm excited just with that question. But we're going to ask more questions, but I'm going to let you start, Dr. Dolly. Over to you, Dr. Dolly.
Okay, so how are you, wonderful people? Great to be here again today. So on behalf of the Salad Master crew, I wish you all a convivial welcome, and we are going to have a merry and enjoyable time today on this program, Your $1 Billion Body. And we are going to deal with the topic understanding COVID-19 today. Now, let's start. What is coronavirus? Is it a human being, an animal, a microbe? You would ask. Well, I would say that it is a microorganism or microbe that they exist in nature as unicellular, multicellular, or cell-clustered organisms, and they are widespread in nature. Most of it beneficial to humans, but some of it can cause real serious harm to the system. Now, we have types of microorganisms. Actually, they are divided into 6. Number 1 is bacteria. Bacteria can give you infections like typhoid fever. Another one is AKI, which is beneficial to man. The disease it causes hasn't yet been recorded. The third is fungi. Fungi can cause diseases like eczema, ringworm, and then protozoa. Number 4 is the protozoa. Protozoa gives you what we call the malaria we suffer is in the protozoa family. And the 5th is algae. Algae gives you stuff like shellfish poisoning. Those of you who are allergic to shellfish will understand this one better. And now the 6th one is the viruses. Viruses is our mainstay today, and coronavirus, as the name implies, belongs to this family. Now, what are viruses? Now, viruses are obligate intracellular parasites that rely on human beings and animals for replication and survival. Now, they are infective agents that consist of just nucleic acid and a protein covering. That's just it. They're very simple animals, and they need human beings to survive, or animals, whichever host they choose to inhabit in. Now, examples of these viruses, you have hepatitis B virus, is a virus, and you have human immunodeficiency disease, which is HIV, and then to mention lastly, coronavirus. Now, coronavirus is a virus, and it is a family inside the virus. Now, let's look at the coronavirus family. They are a group of related RNA viruses that cause diseases in mammals and birds. Now, in humans, these viruses, that is the coronavirus, cause mainly respiratory diseases. And these respiratory diseases range from mild to lethal. Now, examples of coronaviruses, like I mentioned earlier, you have number 1, severe acute respiratory syndrome, which is called SARS. And the second member of coronavirus family is Middle East respiratory syndrome, which is called MERS, and COVID-19. COVID-19 is a member of the family of coronaviruses. It's a family. Now, COVID-19 is part of that family. Now, for people to understand easier which family COVID-19 belongs to, that's why they bring out the name coronavirus disease caused by coronavirus or CoV-SARS-2. That's what it's called, CoV-SARS-2 or COVID-19. That is the organism that manifests, and when it comes to you, we now say you have coronavirus disease. Now, let's get down to what is coronavirus disease. Well, it's a new or novel disease from the coronavirus family and is an obligate intracellular parasite. Obligate means without a host, it cannot survive. If a virus falls to the ground, is not a living thing. It only starts living when it finds a host, animal or human, and it starts replicating inside of you. Now, it is a respiratory virus. This is the first time it is ever causing a pandemic. That's why whenever you hear COVID-19, you say it's a novel disease, it's new. It is really new. What we've been hearing of coronavirus previously is that it affects just birds. This is the first time it's affecting human beings, and it's giving us disease of this proportion, causing a global pandemic. Now, as I rightly said, it is first documented or confirmed disease happened in Wuhan, China in 2019, and that's where the 19 came from. And it has many serotypes in which you can see them in the lab now, and it doesn't have long life immunity. What does it mean? It means that if you have come down with coronavirus the first time and you have treated it and it's gone, you can get reinfected with it once again. So that's what it does. And mainly, this coronavirus affects respiratory syndrome. So before I move further, I'd like to explain to you what the respiratory system is. So in other words, I'm trying to tell you where the coronavirus or COVID-19 attacks in the human body. First, the respiratory system consists of the nose, your mouth, the pharynx, which is upper airway. Now you have the trachea, which is a pipe that leads you directly into the lungs. The trachea, once it gets to the lungs, branch out into two branches called the bronchus. This bronchus still breaks down into further smaller branches called the bronchioles, and then you have the air sac. These ones I'm mentioning from pharynx, trachea, bronchus, and bronchioles, and air sacs makes up the lung parenchyma. So basically, COVID-19, the mild one, affects just nose, mouth, and pharynx. That is the upper respiratory tract. Now, when it is complicated, that is when it gets down to the lung parenchyma itself, giving you the severe diseases or manifestations of COVID-19 that people are afraid of. Fine. So the next one we're going to talk about, structure of COVID-19. How does it look like? I know by now everybody is familiar with that. It's a circular or spherical subject with kind of projections coming out of it. Yeah, that's how it looks on the electron microgram. Now, let me tell you how it looks. It's a spherically shaped virus made up of RNA and then protein nucleus, surrounded by a shell or envelope that is club-shaped with spikes that project from its surfaces. And these spikes are made up of glycoproteins, smaller hemagglutinin, dimer, and then M and E proteins on the envelope. Now, its name and it's derived from the appearance. Corona is derived from the appearance of the coronavirus when you view it under the electron microscope. It's viewed as a round virus with a crown of proteins jutting out from its center in every direction, an image that is reminiscent of the solar corona. That is where the name is derived from. Now, this coronavirus, the size, what's called the genome size of coronavirus, ranges from 26 to 32 kilobases. One of the largest RNA viruses, and it can evolve up to 40 million times faster than human beings do. That's why it is kind of difficult to get antiviral drugs against it, because if you develop a drug right now for this particular kind of serotype, before you get down to get it, the drug passes through clinical trials, it has evolved. It evolves at a very great pace. Now, as we all know, coronavirus has caused a world pandemic. First of all, let's define the word pandemic as WHO defined it. It says that when a disease has gone pandemic, it means that it has a worldwide spread. So any new disease that spreads worldwide is called pandemic. And nothing has killed more human beings than infectious diseases. Coronavirus at the moment has affected 11.9 million people worldwide, affecting 313 countries. So coronavirus actually qualifies to be called a pandemic. So in Nigeria, in our beloved country Nigeria, today, the first case of COVID-19 was confirmed on the 27th of February 2020 by an Italian citizen flying from Milan to Lagos. So the samples already Nigerians have tested, the number of people Nigeria has tested for the coronavirus disease is 169,229 people. Of all those tested, confirmed cases are 29,789 cases. And the discharged cases are 12,108. So the active cases of coronavirus currently in Nigeria of today, because it keeps changing, it is 17,012 people. So those are the ones now that we should protect ourselves against. They are the ones actually carrying the active cases. And of all the people that have died in Nigeria, 669 people have died. It is very, very unfortunate to say, but that is the confirmed cases of dead people in the country. And the cases are said to be higher in Lagos and Abuja. They're the highest. And then in Africa, Nigeria, South Africa, and Egypt are the highest.
Doctor, do you mind me pointing?
Yes.
Dr. Dolly, so let me get this right. We have roughly about 200 million in Nigeria?
Yes, we have.
And
yes.
we have 100,000 plus.
Yes.
Tests.
Tested, yes.
Tested.
Yes.
And of which you're saying how many people?
Confirmed coronavirus cases in Nigeria, 29,789.
So if I look at the mathematics behind it, that means 30% of the people that were tested had coronavirus.
That's right.
So isn't that a bit scary for you? Isn't that a bit scary?
It is scary. And not only that, it is still increasing by the day. And according to World Health Organization, massive number of people tested positive for coronavirus just in June alone.
Wow.
Yeah.
Wow.
Just in June alone.
So if we took that and said, well, if the whole nation was tested, and we took that figure, 30%.
Yeah.
That's a lot of people.
That's a whole lot of people.
But we know it's not. But we know not many. But I'm just concerned.
Yes, it's a whole lot of people. And why this program is here is to make sure that more people are not down with coronavirus. That's why we are here, so that you can understand it. What you can understand, you can deal with.
And also, you said of the 29,000, there have been 600 plus deaths.
Yes.
Now, one death is too many. One
death
is
is too many, definitely.
But percentage-wise of
Yes.
that amounts to not a large percentage.
Not quite.
Not a large percentage. I'm just wondering, why are the recovery rates looking fairly favorable on our side?
Yes. That is what we still intend to unravel in Africa. So many myths are around. Some say it's because of the higher temperature, because we're in the tropics, and that could be it. But nobody has confirmed why yet, or that Africa is still going to be the epicenter of coronavirus in the near future. We don't know. But whatever it is, this program is here to curtail the number of people affected and definitely, if possible, eliminate the number of deaths.
But what's interesting is that, I have my family in the UK, even though I'm Nigerian.
Okay.
And in the UK and America, they're saying that the coronavirus is affecting more minorities, blacks,
Yes.
than it is. So there's a little bit of a difference.
I can definitely, because when coronavirus came about, it was more on the Caucasians than on the blacks. To the extent that some blacks were now saying that we are immune to coronavirus. But shortly after that phase passed, we now see more blacks and Asians dying of coronavirus in foreign countries. And now it's now in Africa and it's not killing the blacks as well. So maybe there's something then in our environment that is making us not as fall prey to it as those of our black counterparts who were in foreign countries.
So, I mean, tomorrow, when we're talking about the treatment,
Okay.
I suppose we can talk more about that.
Yes,
Yeah.
yes.
But
okay.
I'm just intrigued. That was very interesting.
Yes, because that brings me to what I wanted to say, that the good news is 98%, a whole 98% of every Nigerian case that contracted coronavirus is still alive, as stated by Channels Television a while ago. So that's a very good thing. And whatever it is that is making the survival rate in Nigeria to be up to 98% is a good thing. And whatever it is, we want to devolve what it is here, demystify it, and keep doing it so that we keep getting immune to coronavirus.
Well, I think that's said with caution. That's
right.
with caution.
Yes,
because I don't want everybody to think that they can just go out and their
No.
chances of.
Of course not. Of course not. What we can do and what we can't do, we are going to still talk on today.
Did you hear, Dr. Dolly? Caution. Yeah. Don't just run out there and
That's
say
the
we're
watchword.
safe. We're not safe.
Yes.
Coronavirus is still out there.
It is.
And it's deadly. Yeah.
It is. Okay. Now, there are 3 strains or 3 types of coronavirus that has yet been discovered up till this moment. Now, type A variant is closest to the coronavirus found in bats and is considered to be the root of the outbreak. Type A type of this coronavirus strain is the root of the outbreak. And this type A is they have 2 subclusters. One subcluster is the one that has been tested and confirmed that is prevalent in Wuhan, China, and the other subcluster of type A is the one common in America and Australia. Now, we have the type B variant too. Type B variant of coronavirus, it is most common also in Wuhan, and this type B is derived from the type A, but in China, it is said to mutate slowly. But outside China, for whatever reason, we don't know, it mutates faster than that seen in China. Then you have the type C variant. Type C, this is the daughter of type B, and it is one mutation different to the parent variation, and it is the one that is spread over to Europe through Singapore, France, Italy, Sweden, England, and this information is published by the journal Proceedings of the National Academy of Sciences. Okay, now coronavirus, we have seen what it is, that it is a microorganism from the family, from viruses, and then that it comes from the coronavirus family, and then we have talked about other members of the family of the coronavirus like MERS and SARS and all of that. And now we've seen how it is, the structure of coronavirus, I've described it, and now we are up to transmission. How does coronavirus spread? Why is it spreading so fast? We have pandemics like HIV pandemic in 2010 and the rest. It didn't spread quite so fast. Why? What makes coronavirus different? Why does it spread like Wi-Fi? Now, let's see. The first type of spread is close proximity. Like WHO has rightly said, if you come close to a person, if you have any close contact with an infected person within 2 meters or 6 feet of that person can cause a healthy person to directly inhale the respiratory micro droplets coming from the person if the person coughs or sneezes, yawns, or even just talking, having normal conversation. There are droplets that come out from the respiratory tract, and that's coming from an infected person to an uninfected person, when you're within close range, you can inhale that respiratory micro droplets into your lungs. And that, when it gets to your lungs, that's when the disease starts manifesting in the person who was previously healthy. Now, another type of transmission is, okay. So now, when a person coughs, each bout of cough can release over 100,000 micro droplets. It can release that, and when it is done, everybody around that space gets it. Everybody around that place gets that's it. Now, the risk of infection also increases the longer time you spend in the presence of someone who is coronavirus positive or suspected to be, and the person is coughing, and you're within 2 meters or 6 feet from that person or within that person. The longer you stay in his presence, the more chances you have of developing coronavirus. Another way of transmitting coronavirus is through touch. Touch. When you touch a contaminated area, let's just take maybe a doorknob, a public phones, elevator buttons, shaking hands with an unclean hands, shaking another person with unclean hands can be so used to that. Tabletops, phones, and after you shake those hands, you will now come and touch either your eyes, your nose, or your mouth. What happens? The virus enters the body by attaching to the mucous membranes found inside the eyes, on the nose, or in the mouth. That's why we say no more handshaking for now. No more indiscriminate touching. And when you touch, you can even touch with hand sanitizer or napkin or cloth. Open the door and then throw into the dustbin. Touching is another way in which coronavirus spreads. So the first one we have said is, first of all, by being in close proximity with an infected person. Second one is touch. And the third is aerosol, what we call aerosol. Now, what are these? Now, these are micro droplets from cough, sneeze that travel through the air for a prolonged period of time and remain there. Now, let's say when an infected person coughs, the respiratory secretion spreads and remains suspended in the air for, let's just say, 20 to 30 seconds. Now, making everybody in that space vulnerable to catching coronavirus. So we should be wary of that. Aerosol is another way in which coronavirus spreads through air. Now, another way in which it spreads is number 4, aerosol generating procedures. You might not be talking, but you can, when you're in the hospital, you go for your dental checks and all of that. Every dental procedure, or most of it, dental surgeries and intubation, what we call, if you're going to maybe you're undergoing a procedure and you want to have something like anesthesia, general anesthesia, they will intubate you. There's something they introduce into your mouth, and when they do that, it can also spread aerosols, because this one, not willingly, but is due to a procedure that you get it. Another way that coronavirus has spread around the world is through globalization and traveling. Most people can get around the globe for less than 24 hours. That has increased the spread of coronavirus through countries, through counties, and through territories. And then another thing is globalization. The world is now a global village. Because of that, people interact, ship articles to and fro. Through all those ways, coronavirus has spread more than any other disease that we have known before now. Now, there's something I want to bring to your notice.
Well, before you bring it to their notice, if you don't mind. So you're talking about coughing and sneezing.
Yes.
So, you know, I used to, before coronavirus came, last year I used to cough and sneeze, and you could cough freely now.
Yeah. Then.
Now when you cough, everybody is like, corona. I mean, you can't identify, I'm thinking you can't identify somebody with corona. It's a virus. Okay?
Just by coughing.
Just by coughing. Yeah.
Of course
So
not.
I just want to for the people out there for our audience out there, please, not every single cough is a coronavirus cough. Am I right?
Definitely not.
Yeah. And not every single sneeze. Are we still allowed to have colds? Are we still allowed to have colds?
Yes, we're still allowed to have colds,
Yeah.
and we're actually coming to that. Surprisingly, most people don't know this. Sneezing is never part of coronavirus.
Wow. Wow.
No, it's not part
That's
of
good.
it.
So we can sneeze freely.
Yes, you can sneeze
We
freely.
just can't cough freely.
But there's a but to the sneezing, because if the person sneezing happens to be infected with coronavirus, you give us the secretory micro droplets that hang in the air as aerosols, and another person can breathe it. That's why screening and sneezing is frowned upon. It's not that screening itself is a symptom of corona. No, it's not.
Okay.
It's not.
Well, I just wanted to just to give them a bit of comfort, to understand that not everybody that sneezes has coronavirus.
No.
And not everybody that coughs. I mean, sometimes I have a little itch on my throat,
Yes.
and I want to cough, and I'm like, I better not cough. Yeah? But I think the safest thing is obviously, like they say, I mean, masks. Are you coming on to that? Or
Yes,
okay, so,
we're going to go to
oh,
that.
okay.
Coronavirus is a whole myth.
Yeah, okay.
We haven't even gotten to that half of it. Now, there's another thing I want to bring to people. It has been circulating since coronavirus started. So let's make it clear. Coronavirus is not transmitted or is not spread or is not gotten to you by blood. So you can actually go to the hospital, and if you need blood transfusion, by all means get it. Corona doesn't go through you through the blood. Another one is mosquito bites. No, coronavirus is not related to malaria.
Wow.
They are not even in the same family. Malaria is protozoa, while coronavirus is virus. So you can't get it through mosquito bites. Now, another thing is, can coronavirus be transmitted through food? Capital no, it cannot be transmitted through food. And you can ask, what if someone with coronavirus is cooking for me? Once the sneeze or whatever gets cooked in hot temperature, coronavirus is dead. So it's not transmitted through food, nor is it transmitted through water, nor is it given, a pregnant woman cannot even give it to their child. Mother to child transmission, no, it doesn't go through there for now. But if it's researched and found that it does in the future, yes, we can deal with that. But for now, it's not transmitted through mother to child. And you can't get it through transplant, stem cells, surgical procedures. No.
So you said you can't get it from food.
No.
Yeah. I mean, you're talking about food that's cooked after somebody sneezes that have coronavirus.
Okay.
Because I'm just wondering, because our brand is Salad Master.
That's right.
And obviously the program is sponsored by Salad Master.
That's right.
And the reason why is because of the nutritional value that we get from our food.
Yes.
And we'll talk about that obviously some later on.
Yes, of course.
But when you make a salad now, if somebody now sneezes on the salad that has coronavirus, what do you say about that?
Well, if someone sneezes on it, salad is not cooked, so there's no high temperature here. But so far, it hasn't been proven that anybody has contacted coronavirus via food. Okay. So we're keeping an open mind on that. But for now, you can go ahead and eat that salad.
So there's a question mark on that.
Yes, that's
But then
it.
if I go back to what you said earlier, if coronavirus touches anything or comes to anything that is not a host,
yes.
So you said an animal or a human
human being.
So is salad a host?
No.
So then surely it would just die.
It will die, yes.
But
just like it dies when it falls up on the ground.
Okay.
Yes.
Okay, so I'm just saying that there's a little logic
to that. Yes, yes, I buy that as well. So now, when coronavirus, you feel that you have been in contact with anybody infected with coronavirus, so it doesn't start manifesting immediately. So that takes us to the incubation period for coronavirus. Incubation period for coronavirus is 5.1 days to 14 days. So if you come in contact with that person and you don't develop any symptoms from 5 to 14 days, it might not be coronavirus. So the symptoms develop in most people, 97.5% of most people. Symptoms start developing within 11 days.
So are you saying that, for example,
yes,
if somebody has coronavirus and they have coronavirus, and then you come in contact with that person,
yeah,
then if you're tested today or tomorrow, you could be negative. Is that right?
Definitely.
But if you're tested in 14 days, that test could change.
Definitely.
Yeah. Okay.
Because it takes a while for the virus to get into the body and then starts working.
Right.
Yes. So that's it. Now we're looking at severity of coronavirus. If you get it from an infected person, maybe you come in contact with someone tested positive for coronavirus and you wait for 5 days, nothing happens. On the 11th day, you start developing fever, cough, and all the rest. Now, when you start developing those kind of symptoms, they are classified into mild, moderate, and severe. Mild and moderate mild and moderate types of coronavirus causes what we call common cold syndrome. So that's what that's what I said. It will just affect the upper respiratory system, which is your pharynx, your nose, and mouth. So it will give you mild upper respiratory system, maybe like your Malay, you're feeling unwell, you have fever, you have runny nose, and it clears. Now, this particular mild and moderate type of coronavirus, it has a better survival chances. After 1 or 2 weeks, it will get you down, but after 2 weeks, you're up and about again. Now, the second type is a severe type. Severe causes pneumonia. And when we mean pneumonia, it means that the lung parenchyma or the lung itself is affected. And whenever the lung is affected, it gives up pneumonia effects. And here, it means that the body's immune system is overwhelmed. And this is when coronavirus produces complications. Now, who are those really at risk of contracting COVID-19? First of all, the first group of people that are susceptible to contacting COVID-19 are 1, people with comorbidities. What do I mean by people with comorbidities? I mean that people who have underlying sicknesses before, people who have diabetes mellitus, hypertension, heart problems, HIV infections, sickle cell patients, respiratory disease patients, people like they have lung diseases, asthma. They are the ones that are susceptible to coronavirus. Second group of people are people who are immunocompromised. Now, a person's state of immunity will determine the severity of this infection. That's true. The state of your immune system will say whether you will have mild COVID-19, moderate COVID-19, or severe COVID-19. Now, people who are compromised now are pregnant women. They are naturally compromised. That's how nature made it. Now, excessive alcoholics, those who binge drink on alcohol, they can come down with coronavirus too. Now, those people who are chronic cigarette smokers, cancer patients, patients who are on chemotherapy, patients who are all on drugs we call corticosteroid drugs, those are immune suppressing drugs. The drugs is meant to purposely suppress the immune system. So if you're on one of these drugs, you are likely to come down with coronavirus. Now, HIV, as we all know, is an immune suppressor. The name is human immunodeficiency, means the immune system in the human is deficient in HIV disease. That also predisposes you to contacting coronavirus. Now, also people who are on hard drugs like cocaine also decreases your immune system. The abuser's ability to fight infections are very low.
So I like something interesting you just said. So people that have illnesses, lifestyle illnesses or illnesses anyway.
That's right.
They are susceptible.
Very, very much.
Okay. So what advice do you have for somebody now watching the show and they say, look, I'm one of the people that are likely to, if I come in contact with somebody, that I'm likely to have problems. I mean, what can they do right now to, I mean, do they have to start looking at how they manage their lifestyle disease, or what would you
Yes,
say?
what I can say to that person is keep a date with us tomorrow, because the next program we are going to fully deal with prevention and treatments. If you have comorbidities, so that you don't come down with coronavirus, keep a date with us. Don't fail for the next program of Your $1 Billion Body. We will tell you how to avoid it, how to go about it, how to build your immune system so that you don't fall prey to coronavirus disease.
Okay, I apologize. Today is about understanding coronavirus.
Yeah.
I'm just jumping the gun. I'm just so excited. I'm just jumping the gun.
God.
Yeah, but I'm looking forward to tomorrow's show.
Tomorrow is going to be power packed. All right. So today we are all about knowing coronavirus, understanding coronavirus, demystifying coronavirus. Then another group of people who can catch coronavirus easier than the general population are people who has socioeconomic problems, or let's just say socioeconomic factors come into play in susceptibility to coronavirus. Like people in public facing roles. There are people whose jobs or whose roles are you must come in contact with people. Now you don't know who has the disease. And as I said earlier, over 12,000 plus people in Nigeria have active cases of coronavirus. So if one of them happens to be in the public place where you're working, then the person is really prone to having coronavirus. Another one is household of multiple occupancy. That means that in the house, several people or many people are living in the house, let's say with grandparents, parents, children, living in the same house with communal activities. You can go out, play, do, in other words, living together brings you in closer proximity with such people. And so those are the people that you see that can come down with coronavirus. And then people who are also living in Lagos and Abuja. Like I said, Lagos alone has like 11,000 cases of coronavirus. Abuja too has an increased number of cases of coronavirus, more than every other city in Nigeria. So people who are living in these two cities should actually be up on their games, more alert to preventing coronavirus than people who are in other places, because the disease is not as much as it is in their cities. Now, another major factor of people who are at risk of contacting coronavirus is demographic factors. What do I mean by that? I mean by people who age. Age plays a very good role. Populations who are older than 50 and above also, because the older you get, the lower your immunity becomes naturally. So they also should be protected from getting coronavirus. And then the race, like we earlier mentioned, Black race, they say, come down more with coronavirus, and Asians. Now, let me add one or two things to that Black race thing. It's not that there's Black race just suffers coronavirus, but like I rightly said, Black race has higher comorbidities. Like in West Africa, has more people who are suffering from hypertension than America. So it is no surprise that when such diseases come, it's going to affect more of those who have those kind of diseases. And then sickle cell is mainly, it's not that it's not seen in other parts of the world, but Africa and Mediterranean is a sickle cell dominant areas. Now you know why it can affect Blacks more than the rest. So those core morbidities that Africans suffer predisposes us to catching coronavirus more than others.
So, Dr. Dolly,
Yeah.
that part that you just mentioned.
Yeah.
Now I'm worried
Why?
because I'm over 50.
Okay.
Even though I might not look it, guys. I want to look it.
You don't look
yeah,
it.
it's the food that I eat. It's the food that I eat.
That's right.
We'll tell them more about that next tomorrow.
Yes, yes. Keep the day.
But also, I'm Black.
Yes.
And I'm African.
Yes.
So should I be worried? I mean, and you mentioned something about when you get over 50, your immune system is
naturally dropping, but it doesn't drop very well until you're in the generic age.
But is there any hope for us over 50s?
Of
Because
course.
surely we can do something to make sure our immune system is just as strong as somebody that's 30 or 20.
Beautiful. That's why we are here. Now, if you're over 50 and you don't happen to have any comorbidities like all these lifestyle diseases, hypertension, diabetes, you're good. And then if your immune system is up, man, the virus stands no chance. So if you're over 50, that's the more reason why you should look at your immune system. Bring it to the front burner of your life. It's not a joke. Bring it up, and when it's up, immune system fights any virus, bacteria, protozoa, and all the rest. It fights it if your immune system.
So our immune system is the one.
That is
Our
it.
immune system is the one.
That
We're going
is
to talk
it.
more about that tomorrow, I think.
That's right. So that's it. Now, let's come to the symptoms. What do I need to be presenting so that I know that this symptoms I'm having in my body is not malaria, but coronavirus or COVID-19 disease? What do you need to see in someone to say, that person is a no-go area for me? I might just catch something going close to this person. Now we look at it. What are the symptoms of coronavirus disease or COVID-19? Now, I'm going to lay it out as laid out by the Director General of Nigerian Center for Disease Control, said it. Divided it into first stages. The stage 1, he said, is the asymptomatic stage or the non-symptom stage. Here, you are a healthy carrier of the disease. You have coronavirus. It's positive in you, but you are not showing any symptoms. You are just like every other person. You're healthy, and nobody has a way of seeing it. Now, this is the first stage. Second stage is the stage we call the pre-symptomatic stage. Now, this occurs 2 to 3 days before the symptoms appear, which means you might have gotten it 5 days earlier, because the incubation period for COVID-19 is said to be 5 to 14 days. But most people averagely start showing symptoms at 11 days. So maybe you've gotten it 11 days back, and all those from day 0 to day 11, you have been a healthy carrier, showing no symptoms whatsoever. Now that takes you to the second stage, which is the pre-symptomatic stage. 2 to 3 days before the symptoms appear, the patient starts complaining, what we call malaise in medicine. You are feeling malaise. To the normal parents, it means that you're unwell. I don't know how my body is doing me. That's usually what I get from my patients. My body is doing me somehow. I don't know how my body is doing me. This is a symptom on its own. If you don't know how your body is doing you, it's a symptom, and is in keeping with COVID-19. Another one is you bring food, you test it. I don't know how. I can't taste this food. Then when they ask you, is it sweet? I don't know. Is it bitter? I can't tell. Loss of taste, followed by loss of smell. Everyone says, something is not smelling right around here. You don't know, because you can't perceive. And you notice that it just started. That's a warning sign. According to Professor Tim Spector from King's College London, he says that if you lose your sense of smell and taste, it means that you're 3 times more likely to have developed coronavirus. Now, the third stage is the infectious stage. Now, and this infectious stage, you have the earliest symptom of COVID-19. After you say, I don't know how my body is doing me, now you are now start coughing, dry cough, just from that one. That's an alarm bell, should be going off in your head by now. Now you start having fever. Just my body temperature just increased. It didn't just increase, something is happening, creeping up on you. So this program is to make you be alert to all those things. Don't let it creep up. Stop it before it stops you. The next thing is fatigue. I don't want to go out. I don't feel like going out. I'm tired. Can I sleep a little more? You used to wake up by 7 a.m. in the morning, and now you're waking by 9. I don't know. No, my body. Take a second look. Something might be coming up. Another symptom, apart from these 3 symptoms, those are the early symptoms. You have fever, you have dry cough, and you're tired or you're fatigued. That is the earliest symptom of COVID-19. Now, the earliest symptoms is the fever starts getting higher, getting to 36 or 38 degrees centigrade. That should be a problem. Now you have sore throat. When you want to swallow food now, it starts paining you here. Oh, I can't swallow, something's paining me here. And when you talk, sometimes your voice becomes worse. Now that's symptom of COVID-19. And then the dry cough you have initially now starts getting worse, starts getting productive. If you cough now, you produce something, produce sputum. That is also in keeping with COVID-19. And then again, you start having shortness of breath. You'll be breathing like you've climbed how many flights of stairs. That's a warning symptom. Then again, you have headache. But this headache is not for everybody. Not everybody comes down with headache at this stage. Then you now have nasal congestion. Can't breathe. Your nostrils are blocked. That's a symptom of COVID-19. And I also want to bring to your knowledge here that also sneezing doesn't come up in all the symptoms I've mentioned so far. Sneezing is not a symptom for COVID-19.
Wow.
It is not.
Wow. Because I get worried because sometimes I sneeze.
Okay.
And I sneeze because sometimes the air conditioners, I'm not used to air conditioners. I sneeze because I think it's dust or something that might be going.
Okay.
Yeah, and I get worried when I sneeze because people are like looking at me like this.
Oh.
Yeah. But you've mentioned all these symptoms.
Yes.
Now, if you have these symptoms, do we go to the hospital or what do we do?
Yes, we're getting to that.
Ah.
We're getting to that so that we don't confuse them because there are a lot more symptoms coming up. Now, we just dealt with the moderate symptoms. Now we have the mild symptoms. Now we have the later symptoms or the moderate symptoms of COVID-19. Here, it now graduates to body aches. Your body is paining you. The fatigue is increased. You are having abdominal cramps right now, and you might have diarrhea. That is stooling and productive cough, like I mentioned earlier, chest pain. And instead of the nostrils being blocked now, it is running. Well, I've seen a coronavirus patient that told me that I used to have runny nose before, but this time around, it was a lot messier. That's how you know. Then severe stages of COVID-19. These severe stages is the COVID now has become complicated, and definitely by this stage, nobody will be caught at home. You can't be at home. It's not possible. By now, you're getting breathless, even at rest. You've not done anything. You've not climbed any staircase. You've not carried any load. You're seated here, you're resting, and you're out of breath. That's when you know that COVID-19 is getting complicated. You are exhausted. You fought like 10 men in a boxing ring. You're exhausted. You can't talk. It's difficult to speak more than a couple sentences without taking a breather. That's one of the symptoms. Now, another one is when we say you have very severe inflammation. The inflammation is occurring in the lungs and is due to antibody-dependent enhancement, where your immune system may go into an overdrive, causing severe inflammation. That's what happens when you see young people dying of COVID-19. The immune system has gone overdrive, now harming the host or the human being, which the immune system was meant to prevent, because the body doesn't have any knowledge of coronavirus before. So it will now mobilize itself and all the white blood cells to fight it at a very increased rate. As most times it's very bad for the host when your immune system goes into overdrive.
So you're saying that the white cells?
Yes,
Yeah.
the white blood cells.
So the immune system fights. So really, when coronavirus comes, your immune system fights it, does it?
Yes.
It fights it.
That's right.
So that means that your immune system being stronger
needs to
has
be
a big fight.
Yeah, it needs to be on
Big
point.
fight.
Yes.
I like to have a big fight with coronavirus.
That
means I need to get my immune system strong.
Strong,
Wow,
because
we're going to talk about that tomorrow.
Oh my gosh.
I'm so excited. I want strong.
Yes. In med school, we call the white blood cells the little soldiers in the body, fighting for the body. So when you don't feed your body, your soldiers are down and out.
Wow.
Yes. So the last symptom on this severe stage of coronavirus is, like I said, difficulty in breathing. Difficulty in breathing is different from being breathless. Breathless is, I can't breathe, but difficulty in breathing, you actually struggle to push air out of your lungs. That's a huge difference. And anybody you see that's like this, it's getting pretty bad. So difficulty in breathing, showing evidence of developing pneumonia. Yes, the disease is now in the lungs. which gets worse very quickly. It was this was observed by a doctor called Dr. Berhardt. He's a senior clinical lecturer at the University of Exeter Medical School. Now, we've done with the symptoms. We've dealt with the asymptomatic stage, the pre-symptomatic stage, and the symptomatic stages, which we also classified as early, moderate, and severe. We've seen all that. Now, when you are down with coronavirus, you're in the hospital or you are at home. But I don't believe that you can get to the severe stage and still be at home. It is now very dangerous for even the person who's sick and the people taking care of him at home. Now, risk is not everybody that comes down with coronavirus that died. As I earlier mentioned, 98% of Nigerians who contracted it they are still alive, they've not died. So, what are the risks to know that this patient is dying of COVID-19? First, if you bring a patient with moderate symptom and all of a sudden the patient has inflammation of the lungs, how do you know that? You can't see the lungs, but the way it manifests for health workers to know is air hunger. The patient is breathing, but no air is entering the lungs. That's what we call air hunger. You're breathing, breathe in, out, nothing is entering, and your body is hungry for air. That's when you know that this person is really a very bad prognosis for this person. So majority of people with moderate or severe symptoms will progress to have this inflammation of the lungs, and it can result in damage to the lung tissue, but also importantly can prevent oxygen from being transferred into the bloodstream. Another sign that this person suffering from coronavirus might die is when you have fluid in the lungs. Fluid in the lungs is a bad indication. Then also when you have blood clots developed in the bloodstream, the person starts throwing embolites, maybe to the brain or to the lungs. That is when it becomes very bad. Another one is showing signs of sepsis. The signs of sepsis are fever. When they measure they do your vital signs, your blood pressure is low blood pressure, difficulty in breathing. When the person goes to pass urine, maybe you've not passed urine for the last 24 hours, and when you do, the urine output is low. That's a bad sign. Now, another bad sign is excessive sleeping or chills. The person is just rigor. You have it rigor and chills. Cover me, and the room is everybody's like I'm hot. The person like I'm still cold. Give me blankets. That's what can happen in such things. Or another thing, the person starts having mental confusion. Person is in the hospital, and if you ask him, he said, "I'm in my house." Wow, that's when you like this is a bad case. Now we've seen the symptoms, and we've seen also the signs of those who are at risk of dying from coronavirus. Another one we are going to look at is the complications, or what we call sequelae of COVID-19. Number one is acute respiratory syndrome. That is what presents when you have air hunger. When we have it, we are now diagnosed as having acute respiratory syndrome, which is a complication, a very bad one at that. The second is irregular heart rate, or what we call arrhythmia in medicine. When your heart rate is irregular, highly irregular, that's a complication of COVID-19. Then it can lead to cardiovascular shock. Yes, because as we said before, those who are at risk of dying, they often develop blood clots. And with blood clots, you can have cardiovascular shock. Then you have severe muscle pain, what we also call myalgia in medicine. Now, you're not, the first one I mentioned when I said moderate symptom is body ache. Aching is different from pain. And now this pain is classified as a severe body pain. That is a very bad complication of COVID-19. And then you have excessive drowsiness, confusion, which means the psychological effect of COVID-19 is playing out. Now, okay, so that is what it is. So in this episode so far, I don't know whether Mr. Tony has questions for me.
Questions? I think Marvel was actually compiling the questions.
Okay.
But I think what I'd like to say is that obviously first, thank you for the information.
Okay.
I'd like to also say to the people out there on YouTube and also on Zoom to try and see if they have any questions. But I'd also like to say, I've asked a few questions and you've mentioned the fact that tomorrow is the treatment and
prevention.
The prevention. The
Yes.
treatment and prevention. So I think
treatment, prevention, psychological effects of COVID-19 and how to deal with them.
So I think a lot of people probably would have lots of questions on treatment, prevention, and like you said, the psychological side behind it. Yes. And I think one of the things that I think the questions I was going to ask was like, you know, is it possible to have had COVID-19 or coronavirus without realizing, and also have recovered from it without realizing?
Excellent question. Yes, it is very, very possible to do that. Like I rightly said, in grading the symptoms of COVID-19, we have the stage 1, which we call the asymptomatic stage, the healthy carrier stage. At this point, you have COVID-19 in you, but you're not showing any symptoms. And if your immune system is at the tops, it will deal with the virus even before you manifest with anything. And if it knocks out the virus, which means you have already contracted the COVID-19 and you are the healthy asymptomatic carrier, and your body or your immune system has dealt with the virus and it's gone. So you didn't need to go to the hospital, you didn't need to get tested, you didn't manifest with anything. You yourself don't even know that you had it.
So that's interesting, because I know there's a few people that are probably wondering, because of the symptoms, that they think they might have gone through that and might have thought, it's possible you think it's just like a normal flu, you know, or something like that, and just go through the stages. But this time the flu is taking much longer and it's getting a bit more, a little bit more severe.
Yes.
Yeah, but you still carry on through and you come out victorious.
Yes.
But what you're saying, if I'm right, is you can have it, not realize it, but your immune system can fight it on your behalf.
Yeah.
And because it's fought it, you just come out of it without having to
scratch.
Exactly. So again, that's one of the reasons why I think tomorrow is going to be a good one for us.
Yes.
Because I think a lot of people want to know. I would love, I mean, I don't want it, but guess what? I'd love to have an immune system that fights it on my behalf.
That knocks it off.
Fights it on my behalf without me realizing.
That's right.
And then I'm back again.
Yeah.
I'm back again. So Marvel, I don't know whether Marvel can hear us. If he is there, if he can just let us know if there's any questions online with regards to that. Marvel, are there any questions?
Okay. Wow. Amazing. I must say thank you very much for this very informative session. Lots of people are, can you hear me?
Oh, well, I can hear you, but I just want to comment. I love the background that you have. That looks like Lagos. That looks like Lagos Island. It's
Lagos.
Yeah, it's Lagos. Oh, it's a beautiful city. Anyway, carry on, Marvel. Any questions?
Thank you for the compliment. Thank you. I want to say we have lots of people connected on YouTube and also on Zoom right now watching, and they are so impressed. The information coming from the studio right now is so impressive and is really helpful at this time. Someone has asked a question. He said, can someone contract the coronavirus from a barbering shop, a barbering salon? Is it possible?
Okay, fine. The question is a very reasonable question. I really do like it. Yes, someone can contact coronavirus from a barber shop, but not from barbing your hair. The problem lies when if your barber or anybody around you who is not 2 feet or 6 meters away from you has coronavirus, coughs, sneezes, yawns, and releases respiratory micro droplets into the air. And when this is done, you being in that space, especially as barber shops are enclosed spaces, can now inhale the micro droplets, or aerosol as we call it. And when you do inhale that, and the virus attaches to the mucous membranes that lines either the eyes, nose, or the mouth, and gets straight to your respiratory system, that's when you can contact coronavirus. But from the process of just barbing your hair, no, it doesn't do anything. So it helps that if you must have a haircut, you must prevent and fortify yourself from people who might likely be infected in the same shop.
But that's amazing. But you know, I don't think we should say barber shop. I think it can be any shop.
That is it.
It doesn't have to be a barber shop. It can be any shop.
Yeah.
Because I don't want us to say don't go to the barber shop.
No.
Because if something happens, you will get. No, I think it's any shop. It could be what kind of shop? It could be a food shop. It could be anywhere.
Crowded, open place.
Open place.
Anywhere.
It could be an event. You know, so really, it's not specific to the shop.
No.
It's more to do with what you said.
It's more to do with how close you are with someone who might be infected with coronavirus.
Are there any tests that we can do? Like, you know, because we protect ourselves in our office. By the way, we're in Lagos VI office, the Salad Master.
Yeah.
Remember, the program is sponsored by
Salad
Master.
Master. So
thank you very much, Salad Master. We are very appreciative of you sponsoring this program. But I know in the Lagos VI office, Salad Master's Lagos VI office, I know we take precautions, masks, hand sanitizers,
yeah.
soaps, and all this, and testing you and your temperature level and so on. And that's just to keep a safe environment. But are there any other tests that
you can run?
You can have?
No. Just test for coronavirus. Yeah. Yes, that's the only thing that fixes it.
Okay. So it's possible that somebody can have coronavirus, but pass all those tests, like the hand sanitizers, the temperature gauge, and so on. It's possible.
Well, depending on the stage, it has 14 days incubation. So if from day 0 to day 14, the virus is inside the body. From day 0 to day 5, most likely there will be no manifestation of any symptom.
Right.
Now, from day 5 to 11 days to the 14th day, that's when this manifestation of the symptoms starts coming out.
Okay.
Yes. So now, depending on the day you catch, if you catch the person on day 3, might likely not show any symptom, but you likely catch the same person on the 11th day that he came in contact with someone who is positive, the person will now start manifesting.
So if you're not sure, if you have it, if you're carrying it and you're not showing symptoms, and you come in contact with somebody that then can they get it if you're not showing symptoms?
Yes.
They can.
Yes.
Okay.
Yes. That's why WHO encourages people to wear masks.
Yeah. Okay.
Yes.
Thank you very much. Marvel, any more questions? Marvel, I hope that answered the question.
That indeed answers the question. Thank you very much. I just have one more question, or 2 more questions, I would say quickly. Someone is asking, since Dr. Dolly, you mentioned that older people are more prone to actually contracting the disease or the virus, so to speak. The person is asking, does that mean that my 9-year-old or my 11-year-old is safe?
Well, previously, when coronavirus first came out, there was no recorded disease of children and they were thought to be safe. But right now, that's why opening of schools are being the governments are being very careful about it, because right now, children have also manifested with some symptoms of coronavirus that is peculiar to their age group. So parents are not encouraged to take children to shopping malls, open places. Right now, keep them at home, keep them protected, and keep them safe. Because taking them out there, they can actually contract coronavirus. But their symptoms are basically not as same as adults, but they do have it.
But am I right in saying, Marvel? Am I right in saying that children or anybody
Yes.
children or adults,
Yes.
if they come in contact with someone with coronavirus,
Yes.
they get it, don't they? Or am I right?
Yeah, children do get
Yeah.
coronavirus.
I think what Marvel might be asking might be, since their immune system is strong,
Yes.
then surely they should be able to fight it.
They
Am
should
I right?
fight it.
Or
Well,
am I wrong?
Well, for children, when they are very young, we have what we call thymus, that is in children. It's also part of the immune system. But as they are growing, it gradually shrinks and fades out. So when the thymus is there, it fights, it helps protect the children. But then their immune system is strong, but that doesn't mean that you openly expose them to it, because coronavirus is, like I said, a new or novel disease. So all the manifestations are not yet out there for us to see. So in order not to be caught unawares, the thing is to protect the young ones.
I suppose it's very dangerous for a child to get coronavirus because in terms of spreading it, it can spread quite fast.
In children, that's right. It will spread like wildfire, especially in schools. They don't know what social distancing means. Children cannot actively maintain 2 meters away from you. No, a child sees you, the first thing is coming for is a hug and a peg and all of that. So they are a group that is very dangerous to expose to this virus because they can spread it. And a child in an African setting, a single child will be carried by the mom, dad, grandma, uncle, auntie, passes it around just like that. And a child doesn't know what is called cough etiquette. No, if a child wants to cough, he just coughs. If he wants to yawn, he just yawns. It not just does he release aerosol, release micro droplets, and release even the sputum and moves on. And another child can just come in and it spreads like that. So now the best thing is keep them aware from infected or suspected infected people.
I think in the UK, I mean, my young one, he's 10,
Okay.
and he's in the UK,
Okay.
and they've opened some of the schools,
Okay.
and they did the distancing, and whereby they went through the distancing. But I heard that within one day, the children demolished the distancing. In fact, they just were like, what is this all about? We want to play. We want to have fun.
That is
we don't care what you have. We just want to play with you. So that, as long as you're ready for that, then you open the schools.
That is it. And if you're not ready for that, you can't open the schools because you don't know what will happen. Because they don't just want, like you just said, they want to have fun. And anyway they do it, they just want to have fun, and we can't afford that. Can't afford that.
Well, you had one more question? Thank you very much.
Okay.
I think Marvel had one more question, but I think he might be finishing. Marvel, do you have one more question, or shall we just wrap up? Okay, so it looks like there's no more questions. Yeah, I'd like to say thank you, Dr. Dolly.
My pleasure.
And I'd like to say thank you for our audience on YouTube and also on Zoom. And if you have any more questions, please come on the next show, which is tomorrow at 6:30, am I right?
Yes, 6:30 p.m.
p.m. Friday, 6:30 p.m. Friday. Set your alarm. Yeah. So, Dr. You want to say anything more?
Oh yes, and here we draw the curtain for today. But today's topic will help you very much in understanding tomorrow's topic. So now today we have dealt with coronavirus, what it is, that we've seen that it is a virus, it belongs to the coronavirus family, that the actual thing that causes this disease is called COVID-19 or SARS-2. That's what the organism is called. And we have seen the symptoms, we have seen those who are at risk of dying, we have seen those who are at risk of contracting it more, we have seen the ways in which you cannot get it, like water, food, and all the rest. All those ones are building a background for what we are going to do tomorrow. So for you to understand tomorrow's topic, you need to understand today's topic so that you know exactly why we say, if we say you should do this in prevention, you know why. Because you've known the virus, you've known the structure, you've known how it manifests and how to now avoid it. So here, I'm telling you to stay hooked on this program tomorrow. The program, once again, is Your Billion Dollar Body, proudly sponsored by Salad Masters. And for today, we are going to draw the conclusion on understanding coronavirus. Once again, I am your host, Dr. Dolly, aka Dr. D. Hope to see you tomorrow.
Thank you, Dr. Dolly. Thank you, Dr. Dolly. And one last thing from Salad Master. At the end of the day, what we're looking at is we're looking for you to boost your immune system. Because just what you heard today was about boosting your immune system and having a fight with anything that comes your way. And also trying to see how you can manage those lifestyle diseases. Yes. So what Salad Master is doing is we've got these masks here, which are our masks. Now in Nigeria, we have Lagos, we have the Excel region. Yeah, so we want you to win a mask. So look out, tomorrow you're gonna have an opportunity to win one of our Salad Master branded masks. Also, this Salad Master machine here, this Salad Master machine here is an amazing machine. You can cut salads that are gonna boost your immune system. So what I'm gonna say is, what we're doing at the moment, we're doing a special promo at the moment in Salad Master where you can get one of these free. Yeah, you can get, did you hear me right? You can get one of these free, but we'll tell you how you get it. We'll tell you what you need to do to get it. So please stay tuned. And again, thank you very much, Dr. Dolly. Thank you very much, Marvel. And also thank you very much to our sponsors, Salad Master in the VI office in Lagos. And we're looking forward to seeing you, Dr. Dolly, tomorrow. Thank you very much and have a great day. Thank you. Bye. Bye.
Bye-bye.
Bye, Marvel.
Bye. Bye, everyone.
Okay.